Adaptation of the 5-hour method for clients who are not yet ready to quit. Brief interventions for tobacco cessation in primary health care. Areas covered: Introduction to the 5-hour brief intervention model, components of the 5 hours, principles and techniques of motivational interviewing. Learning outcomes. At the end of this module, the participants should be able to describe a brief 5-hour intervention, when to proceed forward with a 5 hours intervention, the components of a 5 hours intervention, each individual component of a 5 hours intervention. The 5 hours brief intervention model. Relevance, risks, rewards, roadblocks, repetition. Components of the 5 hours. Relevance. How is quitting personally relevant to you? Risks. What do you know about the health and non-health risks of tobacco use? Rewards. What are the rewards of quitting? Roadblocks. What would be difficult about quitting for you? Repetition. Repeat assessment of readiness to quit. If still not ready, repeat intervention at a later date. Relevance. Have a discussion with the client to identify his top priority. Relevance to quitting tobacco use will differ according to the client. Reasons for and against tobacco use among adolescents and youth. Probable reasons for use: to seem smart and cool, to enter or be part of a gang, in order to appear older. Reasons that can be used to counter tobacco use in this age group: unpleasant odor, wrinkling of skin, discoloration of teeth and eyes. Reasons for and against tobacco use among men. Reasons for use: perceived freedom to start or maintain behavior, symbolization of superiority or strength, to make another party guilty. Reasons that can be used to counter tobacco use in this group: addiction and nicotine dependency, making a man helpless or unmanly. Reasons for and against tobacco use among women. Probable reasons for use: for equality. Reasons that can be used to counter tobacco use in this group: loss of attractiveness, being a role model for the children. Dangers of secondhand smoke exposure. Every tobacco user is an advertisement. Risks: direct, health and non-health; indirect, environmental, economic, socio-cultural. Syndemic of COVID-19 and tobacco. Risk of complications and death is higher in smokers compared to non-smokers. High risk of contracting sharing of cigarettes, beetle not sterilized. High risk of spreading, touch mouth frequently, spitting frequently. Rewards: what are the benefits of quitting tobacco? Roadblocks: what are the barriers you anticipate in quitting? Withdrawal symptoms, peer pressure. Repetition: repeat assessment of readiness to quit. If still not ready to quit, repeat intervention at a later date. Principles and techniques of motivational interviewing. Do not tell the person what to do. Listen and show empathy. Help the client see the gap between what they are and where they want to be. Let the client tell you that they need to change. Help the client feel confident about changing. Diffuse the client's resistance without antagonism. Spirit of motivational interviewing. Collaboration, evocation, autonomy. Basic principles of motivational interviewing. Avoid argument, roll with resistance, express empathy, discuss discrepancies, enhance self-efficacy. Summary: 5 hours. model is used to guide brief interviews in relation to people who are not yet motivated to quit. It requires the medical professional to guide the client rather than prescribing methods to quit. The interviewer shall respect the autonomy of the client and work in collaboration and through evocation in achieving the intended outcome. Thank you.